Welcome everyone to this collaborative webinar between the Donkey Sanctuary, Austral Journal of Veterinary Sciences and Universidad Austral de Chile. We're delighted to welcome you here today on behalf of the editorial board of the special issue on working equids of the Austral Journal of Veterinary Sciences. I'm Fiona Cooke, I'm head of research at the Donkey Sanctuary, and I'll be providing you with a brief introduction to the day. Today's webinar on the health and welfare of working equids, horses, donkeys and mules is a continuation of the special issue to further share the work of the authors in this really important subject area. Over the course of the webinar today, we will hear 7 presentations from speakers from the Donkey Sanctuary, the American Fondouk, the University of Edinburgh, Murdoch University and Universidad Austral de Chile. The presentations will illustrate the critical contribution working equids have made to human lives and livelihoods, and the human-equid interactions and relationships fundamental to working equid lives, and the importance of supporting and championing working equid health and welfare. For our exciting presentations today, panel 1 will focus on veterinary issues, and panel 2 has a broader welfare focus. Each talk will last approximately 15 minutes, and it will be followed by a 5-minute Q&A session. We'll also have a Q&A session at the end of all the speaker presentations today. So first of all, just a short bit of housekeeping before we make a start. Please keep yourselves muted and cameras off unless you're speaking. This will help ensure that everyone can hear properly. If you have questions for our speakers, please do write them in the chat box. We'll keep the chat box open throughout the webinar, and we will keep an eye on it throughout the sessions, and your moderator will read them out to our presenters as well. If you do have any questions following the event, please just contact the authors of the papers directly. The information will be in the chat box as well, or do contact us if we can help at all. Just to note, if anything goes wrong with the technology or the call is disrupted, if you rejoin us on the original link, and we'll be back with you as soon as we possibly can as well. So to start the event today, I'm happy to share that Dr. Faith Burden, the Executive Director of Equine Operations at the Donkey Sanctuary, is here to say a few words of introduction. So I'll pass to you, Faith.
Hello, thank you, Fiona. On behalf of the Donkey Sanctuary, I'd like to welcome you to this special webinar presented in collaboration with our partners at the Austral Journal of Veterinary Sciences and the Universidad Austral de Chile. It's our pleasure to focus this webinar on the health and welfare of working donkeys, mules, hinnies and horses across the globe, and to use this opportunity to gain and share knowledge. As we'll hear, working equids play a pivotal role in the livelihoods of millions of people, providing invaluable traction power, companionship, and of course, access to goods and services. The Donkey Sanctuary hopes for a world where every working equid has a good quality of life. And we believe that fundamental to improving the lives of millions of working equids is the necessity to work in partnership, to share and develop knowledge through research, education and training. I'm delighted that so many talented scientists have contributed their work to the special edition of the Austral Journal of Veterinary Sciences that we celebrate today. And I very much look forward to hearing more about their work, and I hope you too take the opportunity to learn and share new knowledge relating to working equids. Thank you, Fiona.
Many thanks, Faith. And we're now very pleased to also share a video of welcome from Dr. Claudio Verdugo, Editor-in-Chief of the Austral Journal of Veterinary Sciences and Associate Professor at the Veterinary Faculty of the Austral University of Chile.
Dear colleagues and friends, I welcome you to this exciting series of talks about the health and the welfare of working equids. Working equids play a fundamental role in human society, facilitating access to vital resources such as the water and healthcare, but also providing a significant resource, a renewable resource for transportation, cargo, and traction, and are a huge sustain in communities with economies based on agriculture and forestry. However, these animals have largely been ignored by the scientific community, and we are definitely in debt. The editorial team of Austral Journal of Veterinary Science is very happy and very proud to have gathered such a selected group of professionals from different parts of the world, different expertises, and different disciplines to bring to you the latest studies on the welfare and the health of working equines. We expect to have a positive impact on the future of these animals, cementing their contribution they have to human health and livelihood. I want to give a special thank to the Donkey Sanctuary for the wonderful opportunity to host this webinar, giving the visibility and a special chance to renowned scientists to talk about the health and the welfare of working horses, donkeys, and mules. Please join me and enjoy the talks.
Many thanks to Faith and Claudio for their introductions for this very exciting day. I'm pleased to now pass you to Rebekah Sullivan, who is our lead veterinary surgeon for medicine at the Donkey Sanctuary, to begin panel 1.
Thanks, Fiona, and good afternoon to you all. And we're going to start this afternoon by hearing from 3 presentations looking at the veterinary aspects of working equids. I'm going to start this afternoon by introducing Rabiaa. Rabiaa is a vet who works for the American Fondouk in Morocco. Her work focuses very much on working equids, and she's going to be presenting a case series of working equids with encircling hobbling wounds. Looking forward to hearing about it. As Fiona said, if any of you have got any questions, please do put them in the chat. I'm monitoring the chat, and we'll sort of note down and make sure we get those questions answered if we can. Over to Rabiaa.
Hello, everyone. First of all, I would like to thank the Austral Journal and all the contributors for inviting me to this interesting event to share and spread knowledge between professionals. And as we all know, that working equids are not enough presented in the literature. So if we can improve the situation, that will be an amazing thing to do. So thank you for this opportunity. The paper I'm presenting today is about diagnosis, treatment, and outcome following chronic encircling hobbling wounds in a group of working donkeys in Morocco. Hobbling injuries are of major problem for working equids in low and middle income countries. They result from tethering or restraining these animals using hobble materials such as ropes, baling twine, or wire. The use of these materials is ubiquitous and entails many risks like fractures, wounds, deadness, torticollis. And this is maybe due to their lack of paddocks, limited field space per owner, and common use of paddocks, financial value of the animal. The incidence of hobble lesions from different studies showed that donkeys were highly affected in comparison to horses and mules, as we see in Pritchard All study in 2005. It is important to mention that these hobbling materials, when neglected or forgotten, can get embedded within the soft tissue, and this results in severe musculoskeletal damage. Based on our clinical observation of similar lesions received in our clinics for treatment, we conducted a retrospective study of all working equids presented to the American Fondouk in phase between 2012 and 2020. Inclusion criteria were animals presented with lameness and had clinical and radiographic evidence of hobbles. Details of species, wound location, history when available were recorded. Lameness grade at presentation, post-surgery, and at the point of discharge were reported. The hobbling materials, the presence of wire or baling twine was noted. Radiographic changes, treatment protocol, and hospitalization duration outcome were all mentioned in the table number 1 in the paper. All animals included in the study were donkeys and presented with one of these clinical signs. Lameness that varied from 2 weeks to 1 year. The lameness severity ranges from mild to non-weight bearing. The wounds that were caused by hobble materials varied from small circumferential heel scar to some extensive tissue disruption and fibrosis. And in some cases, wounds had draining tracts dorsally or laterally. In all cases, the hobbles could not be visualized or palpated at the skin surface. All the lesions were localized into the pastern region, and the radiographic changes varied from mild periosteal reaction to severe and extensive newborn formation. All animals presented circumferential wounds. 9 out of 16 had a draining tract either dorsally and/or laterally. The lameness grade at presentation varied from 3 to 5 out of 5 on AAP scale. The forelimbs were mainly the affected limbs in comparison to the hind limbs. 10 out of 16 of donkeys had wire around the pastern and 6 had baleen twine. Diagnosis using radiography yielded periosteal reaction at mid-pastern. The lesions ranges from newborn formation to a significant defect within the cortex. In some patients, wire was visible on the X-rays, and a ghost line defect was as well visible when baleen twine is suspected. So as you can see in these two radiographic projections, the first one lateral medial dorsal palmar view of the right forelimb, we can note the encircling radio-opaque foreign bodies at the mid-pastern or at the mid-first phalanx with extensive periosteal reaction associated with severe soft tissue swelling. This animal has wire in situ, and he was lame 5 out of 5 at presentation. In these two radiographic projections, we can notice the extensive periosteal reaction and the defect inflicting the cortex, and how amazingly these hobbled materials can get embedded within the soft tissue. The dorsal palmar view is for the animal who had baleen twine in situ, and you can notice the abaxial and abaxial extensive periosteal reaction forming an outline. And this animal, as I said, has a baleen twine, and in the first, the lateral medial view, the radio-opaque foreign body is to mention that is a wire. On the last image, it's a finding of a donkey with an embedded wire. Recovery after hobble removal was uneventful in all of our patients. The post-operative degree of lameness was reported in only 7 animals. 3 of them completely sound at walk immediately after hobble removal, and 2 were rated as 2 out of 5 lame at walk. 2 out of 7 as well were rated 3 out of 5 lame at walk. Details of the degree of lameness at discharge were available for 13 of our cases. Of these, all were considered by the treating veterinarian to be sound enough to return to work in the context of a working donkey, as the nature of their work is predominantly done at walk, like transporting heavy loads. 5 were recorded as sound, 6 as 2 out of 5 lame, and 1 was reported to have a residual lameness. Hospitalization time varied between 1 week and 6 weeks, with the majority of animals discharged within a month of presentation. All animals underwent surgical removal in standing surgery using xylazine and butorphanol, and a abaxial sesamoid nerve block was required to anesthetize distal limb using 2 ml of lidocaine. So wire or baleen twine were removed using mosquito forceps or wire cutters in some cases. And the follow-up radiographic assessments after removal were performed in the majority of the cases. In terms of wound management, when a draining tract was present, it was flushed daily with sterile saline, and an intravenous regional perfusion was performed using ceftiofur 750 mg in all our patients, except 1 case where no information available in the records. A Manuka honey dressing was applied when available in our hospital, and the half-limb single-layer bandage was placed. Bandages were changed either daily or every other day until the wound healed, and no excess granulation was encountered in any of these animals. As a treatment protocol, we used benzylpenicillin procaine with treatment duration ranging from 4 to 8 days, with or without gentamicin. And in some situations where gentamicin were used, the treatment duration was 3 to 6 days. So all donkeys were treated with flunixin-meglumine or phenylbutazone, and the dose depend on the severity of the lameness. A preventive injection of tetanus antitoxin was performed systematically to all treated patients. Despite having a caseload of equal numbers of horses, mules, and donkeys, it was only donkeys that have ever been presented with hobbles embedded around the pasterns. This may be a function of being of less value in comparison to horses or mules, or due to their stoic natures. Therefore, less care is taken over their well-being. Another hypothesis is these hobbles were placed at young age, and once these animals have grown up, these hobbles tightened and get embedded within the soft tissue and became invisible for owners. We need as well to mention that as well, horses presented to our clinics with hobbling injuries, chronic wounds over the pastern, but never with embedded foreign bodies. In addition, the severity of the lesions associated with hobbling the limb of an animal will depend on the material used for the hobble and how long the hobble has been left on. So improving their maintenance and management will reduce the incidence of these hobbling injuries by educating and sensitization of the owners. Localized infection was evident in most of our patients, although generally this was restricted to the pastern. Normally, the extensive cellulitis that is a common sequela to many distal limb injuries in horses, as reported by Rizekova all in 2017, the cellulitis was less severe than expected in our patients. For this reason, and as a precautionary measure, we treated all the patients with an IVRP and a broad-spectrum systemic antimicrobials. At admission, there was no evidence of joint or synovial structures involvement as the lameness improved after foreign body removal, and during the hospitalization, there was no evidence of associated severe tendon injuries like rupture or loss of their biomechanical function, as these animals underwent lameness assessments and palpation to detect any heat or any swelling. For almost of our cases, there was no evidence of loss of support to the limb or alteration in the posture or function, any of which would be indicative of severe tendon injury or transection. Using ultrasonography to diagnose tendon injury in donkeys is quite challenging, as the size of the animal is small and the smaller region of the pastern as well, and the presence of air infection in the soft tissue. In one study of 56 equids with tetanus, 7 animals were thought to have developed this infection through contamination of hobble lesions. Therefore, tetanus antitoxin was administered routinely for all our cases. It is probable that the chronic, insidious nature of vascular compromise associated with hobbling allowed the development of alternative vasculature. Indeed, it has been shown that collateral vessels can develop in the 2 to 4 weeks following vascular damage, as reported in Keane et al. Study in 2008. In conclusion, to limit the devastating consequences of this poor management practice, and raise awareness among owners in low and middle income countries, a program of owner education and supply of appropriate non-traumatic hobbles has been in place for many years in Morocco, set up by my co-author Kiki at working equid clinics throughout the country, and by the help of the SPANA. I will leave you with this video, and thank you very much.
Thank you very much, Rabiaa. If Rabiaa is here, I'd just like to invite you to turn your microphone and camera on. I've got a couple of questions for you, Rabiaa. Hello.
Yeah.
Hello, thank you for a very, very interesting case series there. I'm going to start with a question of my own here, which was, one of the things that struck me when I read this paper was that over a course of 8 years, there were only 16 animals presented. Is that sort of truly representative of the situation, do you think, in Morocco? Are there more donkeys or more equids that might actually have hobbling lesions that don't come to the centre? Or do you think that with the welfare programme that is being put in place, the incidence of hobbling is reducing?
Thank you for this interesting question. I would maybe say it's probably only owners that can access to our clinics. Can you hear me? Okay, so only owners who can have access to our clinics are presented, in our case study. So going through all the record from 2012 to 2020, the total was 16. But is it representative or no? That could be maybe another study to carry on and to be a real, not retrospective. That will maybe present a half of the majority that normally the reality. So it's just like maybe an iceberg.
Thank you, Rabiaa. And I'm not sure whether you all have the data for this, but has anybody looked at, since that program started, the welfare program in 2002, I think you said, have the numbers of hobbling wounds or hobbling lesions that you see like this, have they reduced? And that actually leads into a question we've had from the audience as well in a moment.
So one of the authors of this paper is Rebekah, and has been working with working equids since 20 years. She will be the best person maybe to ask, as I'm, just 5 years experience with working equids. That would be great.
No, that's fine. Thank you. And
no worries.
Related to that, we've got a question from Glen, who's one of the speakers later on this afternoon. So Glen has said, you might be able to see this in the chat, that it's very fascinating seeing the treatment of these cases. And I think, like myself, he's looking at the suggestion about trying to prevent this through education. And he's asked if you've got any thoughts on the anthropological and behaviour change work that's been undertaken. And where Glen was asking there is he's interested to hear how, I guess really more of the detail of what this welfare programme involves. And again, that's something you may not have the answers to, Rabiaa, if you've been there for 5 years. I'm not sure if Gigi's on the webinar today.
Gigi is on the webinar as well. I think I'm just reading again the question and yeah.
Hi, can you hear me?
We can hear you, Gigi, thank you.
Oh, cool, that's great. Yes, I am on the webinar, of course.
Thought you might be.
So to quickly answer your question, I think the thing about these particular hobble injuries and why did they come to us is that they were invisible to the naked eye. So without a radiograph, and this makes it very challenging for other veterinarians, without a radiograph, many of these would not have been picked up because the hobble is so firmly embedded in the pastern that you just can't see it from the outside. And sometimes you even barely get a wound on the outside, just a very small draining tract, as Rabiaa mentioned. So that's why it's a very tricky diagnosis to make if you don't have further imaging techniques. So that's just one point. My feeling about whether hobbling has reduced a bit, I don't think so. I mean, we started up when I was at Spana. We started up this hobble exchange program where we would give out well-made hobbles, rope hobbles, and in exchange for a piece of wire or a piece of baling twine. But if you go to, and we audited that in a single center, a single village over about a 6-month period. And they did definitely use them. That's already a good start. And they were aware in that village of the downside of using something else, but it was too small a pilot program and too difficult a thing to audit because it's so widespread. I mean, it's completely ubiquitous. And any souk that you go to, any market in Morocco, all the donkeys will be tied up with baling twine, which is actually given over by the parking lot attendants, if you like, so that people can tie them up with baling twine.
And when you,
very ubiquitous.
Just a good point there is when you say the donkeys in the souks are all tied up with baler twine, because there's also another question there. Is that in terms of they're hobbled with baler twine or they're tethered around the neck by baler twine?
Oh no, never around the neck, always around the pastern.
It's always around
pastern
the pastern.
or cannon.
Okay. So just I'm going to keep Gigi on the question here, on the call here as well, because so aside from the handing out of the different hobbles, the other question that sort of Glen's asking there is, has there been any sort of work done on the behavioural aspects, the sort of the human behaviour change of trying to reduce hobbling, or is that a work in progress?
Well, I mean, as I say, that when I was working with Spana for 5 years, we did make an effort to hand out hobbles. And that would be handing out hobbles to anything that presented to us in the souks where we saw hobble lesions. And I had done an earlier study showing that something like 60% or 70% of animals showed evidence of having had hobble lesions at one time in the past. So we did do that, and at the time we would be talking to the owners, of course, associated with it. I think it's so ubiquitous. It would be a massive training program. And of course, at the American Fondouk, we only deal with one small region of Morocco, so our effect nationwide would be much lower.
Thank you. And I can see in the chat that Sky has also asked a question, which it looks like Glen has answered. So Sky, just for anybody who hasn't seen that, was asking whether there are any equine welfare related laws in Morocco against hobbling. To the best of my knowledge, I don't think there were. Gigi, I'm not sure.
No, there's only one equine related law, equine welfare related law, which says you are not allowed to beat your animal in public.
But nothing against hobbling.
But nothing against hobbling.
So I just have one final question for Rabiaa before we move on to our next speaker. Hopefully, Rabiaa, this is a nice quick one. Was it possible to do any long-term follow-up of the 16 donkeys? So you could see in the paper you presented that some of them were sort of discharged from 1 to 6 weeks after presentation, but does anybody know if there's a longer-term impact? Rabiaa, you're on mute.
Well, to be honest, we would love to have follow-up, but not for all of our cases, to be honest.
Don't worry, Rabiaa, it sounds like we've got a little bit of feedback there. It sounds like follow-up would be wonderful, but not yet. Okay, thank you very much. Thanks to Rabiaa, and thank you, Gigi, for coming in there as well. So we're now going to move on to another talk from Amanda Drought. Amanda is another vet. She's currently working as an equine intern at Murdoch University in Western Australia. She's got very keen interest in horse welfare, and she regularly participates in veterinary programs in Indonesia. And she's going to be presenting a retrospective study on assessments of working ponies. I will try to pronounce this, but I might get it wrong. West Nusa Tenggara province in Indonesia. Over to Amanda.
Hello, everybody. Thank you so much for tuning in. My name is Amanda, and I'm going to be presenting some work and research that we've been doing in Indonesia. So this is veterinary aid clinic assessments of working ponies in West Nusa Tenggara province, Indonesia, and this is a retrospective study. This is very much a collaborative study between myself and several colleagues in Australia here, as well as several colleagues in Indonesia. But I am delighted to be sharing our work on everyone's behalf. So just starting with a bit of background information, Indonesia is our closest geographic neighbour down here in Australia, and it is an archipelago country comprising of over 14,000 islands, I believe. But our research is sort of centred around the Nusa Tenggara Barat province, or West Nusa Tenggara province, which is a cluster of islands in the southeast of the Indonesian archipelago, which I've just got highlighted in red there, and I'll just zoom in on the next slide. So zoomed in a little bit closer here, I think most people will recognise and know of Bali as the ever beautiful and popular tourist destination. But if you just head east of Bali, you'll hit the next main island of Lombok, which is sort of the start of the West Nusa Tenggara province. And I've just got circled off the northwest coast of Lombok. We've got the 3 Gili Islands, which is a little cluster of islands. We've got Gili Trawangan, Gili Air and Gili Meno. And this area is an increasingly popular tourist destination as well. So the local people in this area of Indonesia do have a historic relationship with working ponies, whereby horse and cart is quite heavily relied on for transport and logistical purposes, particularly on the Gili Islands, because motorised transport is actually illegal on these islands. So pretty much everything is done with horse and cart or bicycle. And you'll also find that the local people do feel quite a strong cultural connection to their working ponies. I think owing to the fact that it is a centuries-old practice in their culture, as well as, a lot of these families are relying on their horses for income, and so the welfare of their animals does directly impact their livelihood as well. Now, with increasing tourism in this area comes increasing social concern, and I think rightly so, surrounding the welfare of these working horses. I think, we come from our Western societies and cities, and we're not always used to seeing working animals, coupled with the fact that it's a relatively harsh environment to be working in. It's quite hot and humid, so it's understandable that there is a bit of social concern there, which is why in recent sort of years there have been quite regular veterinary aid initiatives to try and help and improve the animal welfare conditions over there. And I think if you step back and look at it from a One Health perspective, there are some implications there as well. So I've just got a couple of pictures here just displaying what you typically see in West Nusa Tenggara. So both of these pictures are taken on Gili Trawangan, which is the biggest and busiest of the Gili Islands. So in the top right, we've got a pony attached to a chudomo, which is the term they use for the carts built for transport of people, so like a little taxi cart, if you will. And then on the bottom left, we've got a pony attached to what they call a dongol, which is very similar, but it's a cart built to carry or transport goods. So things like building materials, food, stock, that sort of thing. So the objectives of this study were just to sort of have a deeper look into the key health and welfare indicators of working ponies in West Nusa Tenggara. And we sort of anticipated that this study would provide a bit of a basis for sort of ongoing assistance and ongoing research into the future. So the way that we collected the data for this study was we retrospectively had a look at the clinical records that were taken on some of these regular veterinary aid clinics that are run in this region. So we took records from the clinics between November 2018 and November 2019. So there were 3 clinics run in that period. And so we had access to 454 clinical records. So the way that these clinics are run is they set up sort of a temporary clinic in a central location on the islands, and the horse owners and drivers can bring their horses through as they see fit. They come through, we collect a little bit of information regarding, you know, horse's name, age, what they're used for, how often they're used, that sort of thing. And then they come through and they have a clinical examination by one of our volunteers, which are usually vets or vet students from Australia. And then they are treated as we see fit. And there are farriers often joining us on the clinics to assist with farriery as well. The volunteers are all briefed before they go into the clinics, just so that everyone is on the same page and that data collection is consistent throughout. So briefed on sort of how we're going to be recording rectal temperature and measuring heart rate, so measuring or counting over 15 seconds and then multiplying by 4, as well as sort of briefed on things like body condition scale that we're going to be used, and what sort of areas we're looking at for sweat distribution and scrotal relaxation, which I will go into a bit deeper further on. So I've just included a bit of a simplified summary of some of our findings here. So these are just sort of your general clinical exam findings. So mean age of the horses was somewhere between 7 and 8. Fairly good body condition score means, so somewhere between 2.8 and 2.9. Temperature and heart rates, relatively standard means there. And then pretty interestingly, we've got quite high mean respiratory rates recorded. And another interesting thing to look at is the gender distribution of this population. So, you know, almost all of the population are entire males or stallions. So we're looking at sort of 80 to 83% of the population being entire males. So this is a bit of a summary of the abnormal clinical findings that we've extracted. So a relatively low percentage of the population showing elevated temperatures and heart rates. Quite interestingly, the percentage of the population presenting with tachypnea was quite high, so somewhere between 77 and 93%. And then we did have a look at potential indicators of heat stress or heat disorders. So looking at observed sweat on the bodies of these horses, which almost half of the population is showing minimal observed sweat or no observed sweat. And again, looking at potential indicators of heat stress, looking at scrotal relaxation in this predominantly entire male population, which we're seeing almost half of these males showing obvious or marked scrotal relaxation, which is quite interesting. So I've just included this little video just to show you a bit of an example of just how high some of these respiratory rates were recorded as. So we're ranging up to 150 breaths per minute on some of these records, and then just pay a bit of attention to how much or how little sweat is evident on this horse, which is sort of potentially cluing us into an inappropriate response and potential thermoregulatory distress going on here. And I've just included this picture just to sort of demonstrate the degree of scrotal relaxation that we are seeing in a lot of these stallions. Again, a potential indicator of some form of thermoregulatory distress going on, or thermoregulatory disorder going on. And I guess this also poses the question of whether or not this has an effect on fertility on these stallions, which is potentially something we could look into in the future. So this is a bit of a summary of our haematology. So in general, most of the haematology results came back normal. We did have a few minor abnormalities, so 2 ponies with less than 32% packed cell volume, a mild hypereosinophilia in 2 ponies, a leukocytosis in 1 pony, and a neutropenia in 1 pony. There were no hemoprotozoan parasites directly observed on the blood smears. However, we do recognise that this is not the most sensitive test, and specific serological tests would be ideal, but we are quite limited in what we have access to in Indonesia. And this is a bit of a summary of our fecal results. So we did fecal flotation to look at intestinal parasite presence, and we found a mean count of 111 eggs per gram, a median of 0, and only 2 ponies recorded counts of over 100 eggs per gram. So fairly minimal evidence of any intestinal parasite burden, which is quite interesting, and it's probably due to the fact that not a lot of these horses are grazing at all. They're all kept stabled, and a lot of their grass matter that they're being fed is actually just picked and transported and fed out of troughs, so very minimal grazing and minimal opportunity for egg parasite pickup there. So as a bit of a summary of what we found, it was quite interesting to see that despite potential concerns for bloodborne and intestinal parasites in these tropical environments, we did see quite minimal evidence of such burdens, albeit we did have quite a small sort of subset of the population tested. And we were quite interested to see that a high proportion of these ponies were displaying signs of potential thermoregulatory distress, which could be pointing to something such as anhydrosis, which is described as a lack of appropriate sweat response following exercise in a hot, humid climate. So there is potential further research warranted there. So, you know, we did see sort of greater than 40% of the population with tachypnea, almost half of the stallions with obvious scrotal relaxation, and a lack of an obvious sweat response in over a third of the ponies that came through. So how is this going to help us moving forward? Like I just said, we are pretty keen to continue a bit of research into the potential for there being a high proportion or high prevalence of anhydrosis in these ponies. So we're looking at doing some further research projects into potentially quantifying or diagnosing anhydrosis, which has been done in the past with intradermal terbutaline testing to stimulate the sweat glands. So there are plans in place to work alongside some Indonesian vets with that sort of a project. And then the other thing I wanted to mention is we have been over recent years been trying to gradually shift the approach of these veterinary aid initiatives, because we feel that you know, there is a lot of local vets and a lot of local horse owners who are really keen and really want to do right by their horses, but they just don't have the education behind them. And I think it's beneficial in the long run to have a more sustainable, more culturally sensitive, long-term sort of model whereby we, rather than just sort of the Westerners coming in, setting up camp and saving the day for a week at a time every 6 months, I feel like we should be more aiming towards sustainably supporting the Indonesians or the locals and sort of empowering them in ways that they can improve the welfare in their own countries. And obviously, you know, more than happy to be there as a support. And it is very valuable for us as Australian vets and vet students to come over and be exposed to this. But ultimately, if it's going to be a sustainable animal welfare model, we need to empower them and show them the way. So I'd just like to acknowledge these organisations for their involvement and assistance in this research and our ongoing efforts. And I've also just included some of the key references in this study, but I would direct you to the paper itself to see the full comprehensive list of references. Thank you so much for listening, and I'm open to any questions that you have.
Thank you very much, Amanda. And as with Rabiaa, brilliant. Amanda's beaten me to it. Hi. So we have got a couple of minutes for questions here. We will be a little bit sort of tight on time, but there is going to be at the end of the whole session this afternoon. We will pick up any questions I miss. So one of the first questions that came to my mind, Amanda, you actually started to answer with your final slide there. Looking at the participants, there's quite a few people here who I know either work for aid agencies or have volunteered or done the work. And you talked a lot in that last slide about the need to empower the local vets and to make it more sustainable. And just wondered if what does it actually involve? Because I feel it's something that those of us who've done that sort of work, we do say, but it's, you know, what does that involve? And I can see actually Glen has put a sort of very related question there is, yeah, how those initiatives are engaged with the decolonising agenda. That one might be quite a long discussion to have towards the end of all the talks today. But yeah, if you could just tell us a bit more about that sustainable approach, what it's involving.
Yeah, so recently we've, can you hear me?
Yep.
So recently we've been working quite closely with some of the local universities and trying to sort of create a bit of a community there and a community with a lot of the local vets as well, you know, the ones that are nearby to these areas, and sort of get them involved in our clinics and you know, have them create relationships with the local horse owners as well. We've also been sort of meeting with, so on the Gili Islands there is what they call a corporation of horse cart drivers, and that they all have sort of their own sort of subset of laws, and they have to have licenses to own horses and drive carts and that sort of thing. And we have been working with sort of the head of the corporation is what they call it, and to see whether or not they would be keen on setting up sort of a long-term model, and they were sort of really keen to be sort of primarily working with the local vets and having our support on the side. So it's just a matter of creating a bit of a community and yeah, befriending the locals and showing them
and networking.
Okay. Yeah, absolutely.
And related to that, and this actually brings in the sort of quite pertinent clinical finding from your paper, and I was really intrigued to see where this was going as I was listening. I thought, where are we going with the sweating side here? And one of the things I noticed, and correct me if I'm wrong, is that a significant percentage of the animals were quite low body condition score. And a significant proportion have also got quite high respiratory rates. And certainly that's something I've seen in clinical practice, both in the UK and abroad, is that where you've got these chronically elevated respiratory rates, that extra effort of breathing quite often does lead to very sort of slow, insidious weight loss. Oh, I think it's great that there's going to be a lot of research into that, because it's certainly not something that I've never seen come out of a study of working equids before. But one of our colleagues, excuse me, he's going to be talking later this afternoon, João. He's very interested in harness, and he has been asking a question of, and I guess that ties in with the sustainable approach, is, has anybody looked at the issues with the carts and the harness methods, and whether that is predisposing this sort of elevated respiratory rate because of that, all the extra work, because you've got inappropriate harness there?
It's definitely been sort of looked at. It hasn't been looked at seriously. We have definitely discussed whether or not we can find, I don't know, an engineer or someone to come and have a look at the model of the cart and the harnesses and see whether or not something can be changed to help sort of the mechanical dynamics of it. It's something we're definitely keen on, but it hasn't really been looked at as a priority as of yet. But
thank you. Well, the good news is there is a talk later this afternoon looking at harness harness methods, and I'm sure that's something we can pick up in the discussion at the end. So we're bang on time to move to the third presentation. So thank you very much, Amanda, and please do stick around if you can, because I think there's going to be more questions directed at yourself later on. So I'd now like to switch to Carolina. So Carolina is our final vet speaker in this part of the presentation, this part of the stream. She got a PhD in veterinary sciences and is a boarded internal medicine specialist, and she's head of the equine clinic at the Universidad Austral de Chile. So over to Carolina.
Hello everyone, I am Carolina Duran. I'm from the University Austral de Chile, and I will present you the report we published in this special issue from Working Equids in Austral Journal this beginning of the year. We were looking into what number of cases and what kind of cases were presented from Working Equids were presented to our veterinary reference center from the equine clinic at the Universidad Austral here in Valdivia, Chile. And we looked into that in the last few years. In Chile, many families still rely on Working Equids, although we are considered as a very well-developed country. Harnessing transport of people and goods, as well as the use of these horses in agricultural leisure industry, is the most common use. Animal health and disease prevention are important to ensure, of course, this adequate performance and welfare of these horses. For this, of course, owner education on disease prevention and animal welfare is essential, but this has to be oriented to what actually is a concern for these owners and these horses. So this is why we looked into the clinical details of the Working Equids that were presented to our hospital here in Valdivia, Chile. So our population were Working Equids that were presented from 2015 to 21 to the equine clinic of the veterinary teaching hospital from the Universidad Austral de Chile. We defined Working Equids as these equids that were used for harnessing transport of people, goods in agriculture and or domestic use. Data were collected from paper records that we have at the clinic. We just recently, 2 years ago, switched to the digital, so we changed to digital records, so we only have the paper records for these cases. The hospital had full diagnostic and surgical facilities and 24 hours emergency service during the time period we studied. Of course, still provides the same service. We recorded case presentation, presenting complaint, diagnosis, and outcome of this Working Equids, and used descriptive statistics for data analysis. Here you can see just an example of 2 pictures of the regular use that they use for transport of people and goods. Working Equids share the roads with cars. In general, you can see that they are kept in quite good condition. So to the results, we've had a total of 107 Working Equids that were presented in this time period to the hospital. The age range was between 1 day to 19 years old, with an average age of 8 years. More than 65% of the horses were less. 65% of the horses were less than 10 years old, and only 28% over 10 years old. The mean body condition score of these horses was between 3 to 5 out of 9, and most horses were just presented ambulatory, were not hospitalized, and if they were hospitalized, this was just happened for a short period of time. And unfortunately, we had missing data in almost 50% of the cases, probably associated to the kind of records that were still paper records in those years. Also, the main presenting complaint were checking the reproductive status of the mares, particularly, and followed by lamenesses in 15% of the working equids and castration in 13%. Diagnosis was reached, or final diagnosis was recorded in 87% of the cases. The most common diagnosis was uncomplicated castration. 9% of the mares were barren mares, presented for reproduction, follow their reproduction status. 8% of the mares were pregnant, and the rest of the horses had lamenesses. 40% of them caused by wounds, distal limb fractures in 50%, foot abscesses or foot care in 10% of those cases. Colic was only the presenting complaint or diagnosis for 3.7% of the cases. Diagnosis procedures, the most common one were imaging, transsacral ultrasound, and radiography, endoscopy, and lab analysis were only performed in 15% of the cases. To the results and discussion, this was actually the first report on the clinical presentation of working equids to a veterinary care reference center here in southern Chile. Previously, many publications have reported information about general health, welfare, and field veterinary care of these horses, but not their presentation on reference center. It's interesting to mention that our horses, we had a predominance of younger horses. It could be that our population is actually younger, or that just owners present their younger horses because they have more interest in their reproduction, or they are being used for work, so they need them in the best health condition, and then they don't do so or care so much for their older horses, and they don't bring them to the veterinary care center. Most horses did not have Drought type morphological characteristics, which historically was the most common breed or breed mix that has been used as working equids, at least in this area. Probably due to that, we have another breed, the Chilean breed. It's a very rusty breed and versatile. So it can be used in different activities, and also needs less food to maintain a good body condition. Due to their smaller sizes, a pony-sized breed. Malnutrition was not reported in any of the cases, which is not is different to what has been reported before in the working equids population worldwide, where malnutrition or poor body condition scores are regularly reported. It's interesting also to mention that we had a lower number of pregnant mares in relation to the barren mares. So probably provide veterinary programs focusing on equine reproduction would be interesting for owners for working equids that we have in our area. Also, wounds and lamenesses were common problems, similar to what has been described previously for working equids, but also for equine population in general. Still, it's interesting that skin lesion and wound lesions were overrepresented, which could be related to their use, but of course we only can hypothesize that because it wasn't a retrospective study. Also interesting that from all the lab analysis were not very frequently performed, probably due to their owners' concerns, economic restrictions, but it's worrisome that there's a poor use of fecal egg counts despite of the widespread prevalence of parasite problems, and the low cost of the procedure is probably something that also needs to be addressed and improved in the future. Also interesting to mention that we had 2 cases of white muscle disease that were confirmed by selenium deficiency. It's a well-recognized issue in southern Chile, central southern Chile, that due to our acid soil, plants can't absorb selenium, and our grass and hay is very deficient in selenium. Thus, having disease associated like white muscle disease to this deficiency is quite common if they don't supplement. Thus, it should be something that we need to put into our prevention programs, to have preventive monitoring of selenium status in this population, and eventually have empirical supplementation programs. With this information, and we believe that, of course, educational and preventive programs are required still in our populations, although their general health seems to be quite good compared to what has been reported in other regions. But we would benefit, of course, with these programs to reach adequate health and welfare in our working equid community population here in southern Chile. So with this, I let my presentation open for questions, and will also acknowledge the invitation from the Donkey Century and Austral Journal for organizing this nice special issue.
Thank you very much, Carolina. I've had a few questions coming through from various methods, so I'll run through a couple of these now, and if we run out of time, because we're going to try to have a 10-minute break before the welfare focus session, we have got, as we have said, the time at the end. So the first question that I've got here is one where we're looking at how are the owners getting the horses to your hospital? And are they prepared to sort of bring them in? Do they leave them at the hospital? Do they have, is there a sort of program in place for if they've got very sick equids that they can use an alternative equid whilst their one is healing, so to speak?
Yeah, the true working equid community in the city of Valdivia, where our hospital is shrinking year by year. We still have like 3 or 4 owners that bring their horses with their carts, in like walking into the clinics, like it's the real walking in clinic. But some of them have little trucks and they bring them into the clinic. Then the other group of horses that is now increasing is not the real working equid community, which is just people that have horses but have very low income. So we have like a differentiated charge. Like the working equids, they don't pay anything. we provide free veterinary care for them if there are very expensive treatments that they have to get. If it has a good prognosis, we try to find a way to pay for it. If it has a poor prognosis, euthanasia is what we have to do. But now the bigger community that we have is the people that have lower incomes with horses, and those, they get like a special treatment. Like, we don't charge for services, but yes, for the supplies. And if they need treatment that they can't provide, like sometimes wound cleaning, bandaging, changing bandaging, administering drugs, they stay until we finish at least the first 4 or 5 days or weeks, and they stay here at the hospital, and then they go home.
Thank you. And
sorry, and the other thing that I forgot to mention is, it's more described in the report, but we have like this program for working equids is not only in the hospital. We are like the smaller part of the program. The bigger part of that program is that vet students and vets from our college go to the areas around Valdivia and treat the horses in the field. Mm-hmm.
Okay, so an outreach type program.
Yeah. Mm-hmm.
Okay, and that kind of again sort of feeds into another question. So you mentioned that the level of malnutrition is actually quite low compared with other studies of working equids. Do you think that ties in with the fact that in general the presentation of equids was of a young animal? Or is it, I guess, if there is this issue with trying to sort of cost of services, are people just not bringing their animals that are old, sick, very thin?
Yeah, so that's a good point, and I kind of mentioned it on the other aspect of, but it's related to that as well. Like, we have younger horses, and they bring, of course, the ones that they are more interested because they are supplying a service for them, I guess, work or reproduction. And we don't see the ones that are in the fields with lower body conditions, older, with more issues. I think it's very biased to what they bring, so it's not a real representation of what we actually have. In general, I think people take care very well of the horses, and we are in the southern Chile where we still have a lot of pasture, so they keep them quite wild, and they are doing more or less okay. But I think it's something that we can't really tell because it's retrospective and it's very biased to what comes here, which the owner decides what they bring, and probably they bring what has a better prognosis and they actually need more. Hard to tell.
Thank you. And I've got one final question, which is, so João has asked, he's pointed out that in other parts of Latin America, there have been attempts to introduce draft type equines to try to improve the working capability of the animals. He was wondering whether there's any similar programs in place with yourselves that you know of.
Yes, there is at least one program that is offered by the army here in southern Chile, which they have a donkey program and mule program and draft horse program. So they provide the services of stallions to do the mixture of breeds and to have more draft breeds. And for like, I don't know when it started, like maybe 10 years or a little more. It was more active years ago. In the last years, it has been not being used so much. But yes, there are those programs in place. Mm-hmm.
Thank you. Well, Caroline has done a great job of bringing the veterinary presentations to a close. So we'll have a 10-minute break in a moment. Just wanted to say thank you again to our 3 speakers. So Rabiaa, Amanda and Carolina, that was fantastic. There's been very different talks, but also some real similarities. I think one thing that each of you all picked up on was looking at the sustainability of the veterinary support. We've had some quite different veterinary presentations that have come out. Carolina just mentioned about the white mussel disease, and Amanda talking about the tachypnea, and I just found Rabiaa's demonstrations or presentations of the hobbling wounds absolutely fascinating. Again, all three of you have kind of sort of hinted at or openly discussed the fact that what you probably see in your clinics might be a skewed or biased population. So I think there's going to be a lot of food for thought and lots of quite good discussion coming up later. But what I'll do, if you could all keep the link open, and if we meet back here at 2:20, so in just under 10 minutes time, and there have been other sort of questions and chats going on, so just take the time as well, just have a look at some of that conversation there, which might be of interest. And that's all from me for now. Thank you.
Welcome back, everyone, to part 2, our panel 2 of our webinar today. Thank you so much for our previous speakers, really fascinating talks there, and looking forward to our next group of speakers that we will hear from now. Our first speaker will be Tamlin Watson. Tamlin is a senior researcher with the Donkey Sanctuary. She's also a zoologist and a behaviourist, and her interests include animal welfare, behaviour, wildlife conservation, work in equids, and also marginalised communities. So Tamlin's going to talk to us today about welfare and access to veterinary health services for mules working in the mountain trails in the Gorkha region in Nepal. So over to you, Tam.
Hi, my name's Tamlin Watson. I'm a senior researcher with the Donkey Sanctuary. So I'm going to talk about this article today. It's about a remote population of mules and people in a very mountainous region of Nepal. For those of you familiar with some of the tourist trekking routes, this region is on the Manaslu circuit. This was a relatively accessible population to us, that's why we chose it. One of our partner organisations, Animal Nepal, works out in that area. Animal Nepal had undertaken some veterinary clinics in a couple of the lower villages that we attended. So there was a degree of familiarity between mule owners and Animal Nepal, which meant that they were sort of more inclined to talk to us more freely. Although obviously using interview data using the system obviously comes with certain caveats. Animal Nepal also provided logistical support, meaning we were able to get to the first villages via their transport. After that, accessibility was all on foot. Working equids are known to be essential for assistance in remote rural populations, mountain populations throughout the world, where a lack of access to basic services can put the health of people and their animals at risk of disease and its transmission. So for this article, we used mixed methods. So we had interviews, semi-structured interviews lasting between 20 and 45 minutes with 26 people, all of whom in this particular article were mule owners or drivers. We also took livelihood surveys, which gathered basic demographics such as gender, age range, earnings, religious beliefs, ethnicity, job roles, and some information about their mules, such as how many they owned and how long they'd owned mules for and where they'd obtained them from. So with regards to mules, we used the EARS welfare assessment tool, and we use a scoping protocol, which means the assessments are just as rigorous but not quite as detailed. So when dealing with groups of animals needing sort of swift turnaround, if people are going and taking them out for work, it meant that we could get through the entire group more quickly. So we assessed aspects including observer approach, things like integumentary trauma, demeanour, body condition score, hooves, lameness. We also recorded the management of the mules, so what their diet comprised of, their access to water and how their equipment was fitted and its condition. So who did we speak to and what did the mules show us? So we spoke to people that were either working with or owning mules. So some of the people that were working with the mules were the drivers, and some of the people owning mules also had other businesses such as hotels or shops. All people resident in that region relied on the mules for income or goods or both. So the mules, we assessed 166 mules. All of them are geldings. All of them were utilised solely for goods distribution and no other tasks. They all had quite good social contact, so even though they were tethered in a line and they could all reach each other. And there was very little antagonism between the mules, so they seemed quite settled groups. Their responses between each other were good, and the responses were mixed with approaches from the assessor, and there was a lot of fearful responses and quite aversive behaviour. Age-wise, again, because of the aversive responses for some of the mules, we were unable to age some of the animals, but we only ever found one animal over 20 years old. Most were under 5 years old. We found integumentary trauma in 90% of the animals. The other 10% were the ones that couldn't be assessed, and there's a good chance that those also would have shown integumentary trauma had we assessed them. Lameness was quite low, but we did have 2 very bad cases, one of which had a broken leg. We spoke to the owner, and unfortunately we were unable to persuade him to euthanise the animal, but he did bring it out of work. And we went back to check at a later date, and the animal was still out of work and being rested. So unfortunately, it's the way it goes sometimes. So the other illnesses that were also found while we assessed the animals was a high instance of trypanosoma. And apparently, according to the vet that was with us, this was quite commonly treated in the region. Also, we found a case of glanders, suspected, and again, because these animals are translocated over large distances, both of those infectious diseases are quite concerning. All the mules, as you can see in this photo, were fed through via nose bags. All had pretty inappropriate diets. They were fed high quantities of dried beans and pulses, so very high starch, very low fibre, very limited access to foraged foodstuffs. Many owners failed to offer mules cut forage materials if they were unable to allow the mules to roam for grazing if they didn't have land. Unfortunately, this paired with the limited access to water, because the owners only usually tended to give animals a very short spell at a small container of water, which they passed around each mule by one. And mules weren't allowed to drink to satiation. So previously, this might not have impacted the mules quite as significantly as it does now. The Chinese have funded a new road that's going through the valley, possibly linked to a hydroelectric scheme being planned, most probably linked to that. And because of this scheme, all the tracks have now been widened and straightened. All the water sources have been canalised underneath the road, and all the forage materials or potential forage materials have been removed. These tracks would have been slow and winding, so now with the straightened roads, the animals are driven at speed down these roads, giving no time for breaks for water because they can't access it, and they also can't have a nibble of forage materials on the way. So this is possibly may lead to the high incidence of colics we observed when we were actually doing the field work. We treated a lot of mules. Also, the mules were exhibiting coprophagia, so the eating of other mules' dung, and pica. We saw an awful lot of mules ingesting plastic wrapping roadside, so trying to fulfil a foraging need, potentially. So what we found and sort of the discussion points. So in all the mules, we saw integumentary trauma. A lot of them were old wounds, so we did still find animals with open wounds, but an awful lot of them were old scars. You can see in this photo, the white marking on the mules here is old scarring. It's linked to the equipment. Those areas are linked to pack saddle placement. And although the pack saddles were padded, the materials that were in direct contact with the skin were usually non-absorbent. There were also, all the equipment was dirty. It also had poor fit. We were told that mules were frequently worked during the monsoon, and they were rarely offered protection. from the elements, apart from very few owners. So harnesses would be being put directly onto animals that were already wet. So the friction when being worked under load and added to the dirty harnesses would rub and break the skin, and this is the result of what we're seeing. So yeah, most harnesses were not fitted correctly. So the cruppers, which is the strap leading around the mule's rear end, were generally loose and made of inappropriate materials such as alkathene pipe. Sadly, the absence of harnessing expertise means that these errors of harnessing will be perpetuated until that's resolved. So with regards to behaviour, the signs of integumentary trauma may well explain some of the avoidance or defensive behaviours in mules if they thought they were going to get put back to work if it had caused pain in the past. The escalation of negative handling behaviours probably causes a vicious cycle, so the animals get fearful, they become defensive, and then their owners or drivers become fearful and become more aggressive in their handling because they're afraid. There was a lot of companion bonding, which is great. It signalled that the animals were in quite good social groups, and some of the owners actually highlighted their recognition of the importance of that social bonding and how it impacted the animals and how they worked better together. There were a few animals that showed apathy, and both those animals had significant health concerns, one of which was the animal with the broken leg. And affiliative behaviours, we saw them mainly in animals that were a body condition score 3. They seemed much more friendly, although that friendliness changed a little bit as we were assessing. They became more fearful as soon as we started to work through their body, around their body. Again, because the mules were under age and had completed one brick kiln season, we wonder if a lot of this aversive behaviour, avoidant behaviour, was because as mules became older, they became a bit wiser. So that could explain why we weren't seeing animals that were older when we were aging them, or perhaps because they were worked at such a young age, they were just dying younger. So the handling and stock person behaviour, again, as I've mentioned, the fear-based responses between owners and mules may have a bearing on this. Some owners had said that they had difficulty securing responsible drivers. Some of the drivers, probably due to monetary pressures or lack of understanding, were driving the mules very fast. So they were trying to do multiple trips in one day. Again, this has been exacerbated by the new road development, which is enabling them to be able to do this. And the pressure is to drive faster without brakes. And this, obviously this highlights the issues around the animals then not only wearing themselves out quicker, but also being unable to get an appropriate diet for themselves throughout the day. So veterinary service provision in the area, there was very limited veterinary provision apart from the visiting NGO and in Mulderpool. Most veterinarians would remain in the city and they would give advice to the veterinary technicians over the phone. So there were 2 veterinary technicians we found embedded within the 2 remote villages, which is great. It's a step in the right direction. They received mainly training in the economically important animals such as cattle and goats, but they received absolutely no training in equids. The only reason they knew about equids was because both veterinary technicians had undertaken voluntary equid-based training, which is great. It's a shame that it isn't included in the normal training, and maybe this is something that needs to change. The vet techs were only supposed to be giving out non-prescription medications and had to phone. There was a heavy reliance on phoning the distant vets to get assistance when required. They were not supposed to diagnose, the veterinary technicians weren't, but in reality lines do get blurred, particularly in remote regions, and we know that the prescription-only items sometimes have to be administered administered in the absence of any other alternative. And this is obviously concerning, and this was highlighted in a previous paper, which I've put the reference to at the end of this talk. Obviously, the misprescribing of drugs and its link to antimicrobial resistance antibiotic resistance is a real worry. However, it's really encouraging that both veterinary technicians were women, and their roles were actually raising their status within the communities and giving them empowerment. Their presence has also increased capacity and resilience within those communities, and both vet techs were very keen to provide good quality advice, support and harnessing guidance to the mule owners. And it highlighted to us their concerns and solutions with regards welfare and potential for improvement. So I think supporting these vet techs to do a really good job will be key to really helping these mules in the future. So these are the references that I think are most pertinent to this article. So the first one is obviously the article I've just spoken about. The next article is one that I've written that sort of provides more detail and that goes in a little bit more depth about the translocation of these animals and the difficulties during transportation and the impacts that actually has on the animals when they arrive in a new place and have to readjust to completely new handling and a completely new environment. The third reference down is the article I mentioned about the antimicrobial resistance and prescription of or over-the-counter giving out of prescription-only drugs by people that aren't qualified to do so. And obviously the final one is about the EARS tool and the development of that. So thank you ever so much for listening, and look forward to any questions. Thank you.
Thank you for that very interesting talk, Tamlin, and really, really great to hear that work. Just to let everyone know, in the chat box, you'll see very shortly that there will be the link to the PDF of the special issue again. So if you've just joined us or if you need that link, it will be in the chat box again there. So Tamlin, some questions have come through for you. So I'll start at the beginning of our questions here. And I know you mentioned about the changed travel and transport infrastructure that you noted while you were doing this study, and we've got a question around those lines asking how long this area for how many years has been using mules, and what changes in land use in the area there have been over that period of time.
Okay, so we're not 100% sure how long the mules have been there, but we think maybe around the 12-year mark, possibly a little bit longer. So there isn't a real historical background in having them. Obviously 12 years is quite a while, but I don't know how much support those communities have had in developing their skills around equines. Previous to the mules arriving, people took everything on foot, and I mean everything, so bags of rice, salt, etc. So they're quite hardcore out there. The mules have made their lives significantly better. Obviously the new road that's coming through is going to significantly impact that, so in some ways it will probably reduce the number of mules that are being used, which is possibly not a bad thing, but it will also impact people's ability to earn money. Mules will still retain their presence because they'll be needed for the remote regions that go further up from the road, but it's certainly significantly, the road's certainly significantly affecting people and their livelihoods already.
Great, thanks, Tam. And linked to that, we've got some questions here around some of the myths that perhaps might affect the way that people engage with their mules and offer them. And we've got, for example, here, some people think that mules don't need water because they get it from forage. And did you hear any comments similar to that, or any myths surrounding their care?
Yeah, well, not so much myths, but I think there was just a lack of understanding. I think it would have been really nice to pull that apart actually, and listen to have a bit more time with people to talk about their perspectives around what animals need to thrive and survive. But yeah, there was certainly a lack of understanding about allowing animals what their needs might be. So they certainly didn't provision water. And although there was one really amazing owner that diverted spring water into a large cauldron next to his accommodation, and to allow anybody's mules to access the water on their way past. But we witnessed time and time again people just driving their mules straight past, both first thing in the morning and last thing at night. So they would go out to work all day without having any water provision, straight after having a nosebag of beans, which isn't ideal. And like I said in the talk, it was probably offset quite well previously when the tracks were slow and winding, and those animals would have had that chance to forage on the way. They would have been able to drink on the way. But with the new road provision, all that's been removed. So those animals are driven quite hard and quite fast now, and for multiple trips. So what would have taken all day now just goes for a day. I also see that asked about the geldings in there. The reason we assessed geldings is because there were no other sexes there. So there were absolutely no stallions, despite the fact that there was no provision for castration services. So we can only assume that those animals are castrated at source in India before they're translocated. So that's why they were all geldings.
Thank you, Tamlin. Some really interesting points there, and some significant changes as well over the years in management and understanding of the mule's needs there. Thank you ever so much. I can see there are a few more questions in the box, so we will move those to our final Q&A discussion as well, so that we can still come back to you on those, Tamlin. But thank you very much for now.
Thanks a lot.
And now we will move to our next speaker, João Rodrigues. João is a Portuguese veterinarian. He has a PhD in veterinary sciences and an extensive donkey medical and welfare experience across Europe, and also with working donkeys globally. João's going to talk to us about an investigation into logging methods using donkeys.
Hello, my name is João Rodrigues. I'm the Senior Lead Welfare Assessment in the Research and Operational Support Department of the Donkey Sanctuary, and the team member in charge of the Donkey Harness Research Project developed by the Donkey Sanctuary between 2018 and 2022. This was a joint project with many different partners involved, and with the present study being developed by the Donkey Sanctuary and researchers from the School of Technology and Management of the Polytechnic Institute of Bragança in Portugal. As a brief introduction to this presentation, I would like to say that working equids represent a major source of energy worldwide and assume an increasingly important role as part of a growing awareness for sustainable energy sources or the use of sound techniques in small-scale agriculture and forestry. Such trend is likely to increase due to the recent global energy crisis affecting fossil fuels. It is also very important to highlight that the effectiveness of their contributions is reliant on their welfare, especially in the case of donkeys that, due to their smaller size, may face more adverse working conditions when compared with other equids. It is not uncommon to see overloaded donkeys, many times working with equipment primarily designed for other species, which causes inefficient use of animal power and directly affect their health and welfare. So the aim of this present study is to understand how the use of different methods during logging operations can reduce the work efforts of working donkeys, and thus creating knowledge to share with those who will benefit the most, donkey owners and users around the world. We want to understand how the use of logging techniques that allow lifting and suspending, both partially or totally, the load from the ground can reduce the force exerted by donkeys, thus reducing the physical effort. We also wanted to understand if there is any strong correlation between force exerted by donkeys and heart rate, measured in beats per minute. So this can be used as a cost-effective alternative proxy measure force used to pull different loads using different methods. In terms of materials and methods of this study, and talking about the donkeys, 3 healthy Zamorano-Leonese gelding donkeys of similar size, phenotype, and body condition were used in the study. Donkeys were selected based on their working skills that must include being used to pull, but also being hitched to a vehicle. In terms of logging operations, 4 logs of Scots pine, Pinus sylvestris, of 5 meters each were used in the study, with a known volume of 0.03 cubic meters, 0.05, 0.07 and 0.1 cubic meters. Volume was converted into kilograms and then in percentage of body weight of the donkeys, going from roughly 10 to 25% of the body weight. You can see these conversions in the lower part of the screen next to each one of the logs used in this study. As a practical detail, the front aspect of the logs were rounded to reduce situations where they may become stuck. This is something common when logging with animals, but in this specific case, it will actually help us to reduce the effect of the environment in the reading of the dynamometer. In terms of the transects, donkeys move the logs 100 meters in a straight horizontal transect, as this distance is considered ideal when logging with equids in real conditions. So during the study, we tried to somehow simulate what happens in the real world when logging with animals. In this case, donkeys were led during the transects, ensuring a constant speed with care taken to ensure that the handler did not interfere with normal movements of the animals. So a total of 108 transects were carried out during the study, and as a way to ensure full recovery from previous physical effort, each donkey had a minimum resting period of 60 minutes between each set of transects. And by a set of transects, we understand when the animals move 4 logs using a specific collar and a logging technique, with animals being kept in a small paddock with access to shade, water and hay while resting. In terms of logging techniques, 3 techniques were applied corresponding to the most common logging methods used in forestry. The first one, what is called direct pull, with donkeys dragging logs. The second method used a forest sled, with logs resting on the sled on one end and dragged on the other end, as you can see in these images. And a third method using forest vehicle that were a combination of a forecart where the donkey was attached and 2 ATV log haulers adapted for the study, with logs being completely suspended on wheels, as you can also see in this image. In terms of harness, and specifically in terms of collars, 3 different collars was used in this study based on previous results of pressure, area and contact obtained in another study that was part of this research project. Collars with the best results in that previous study were included here, and include on your left, as you can see, a prototype collar developed by the harness makers team involved in this project, designed specifically for donkeys to be adjustable, cheap and easy to manufacture using local materials. In the middle you can see an adjustable commercial full collar designed for horses, and on the right you can also see a commercial breast collar also designed for horses. All collars were checked and adjusted at the beginning of each transect by the harness makers team, following standard protocols for harness fitting, and depending on the logging technique used, collars were combined with a pair of traces, a single tree and a light trace carrier in the case of the direct pull and sled, and in the case of the vehicles, collars were combined with a full cart harness. That means the cart saddle, the breeching and the belly band were also included. To be able to measure the force exerted by donkeys, the research team of the School of Technology and Management of the Polytechnic Institute of Bragança developed a swingle tree with a dynamometer and a data logger incorporated, allowing a continuous recording of the pulling force exerted by donkeys during the work with a frequency of 1 force measurement per second. Here in the image you can see in the center the load cell with its S shape, and on the left you can see the data logger with the battery, with the micro SIM card, and any wire was used, which actually we were able to simulate in a very accurate way a normal swingle tree used for logging or for any operation with working equids. In terms of heart rates, a commercial horse heart rate sensor, Apollo 1, was attached to the donkey's harness and used to continuously monitor the heart rate of the donkeys during transects and recovery period. The recovery period started after a set of transects, and In this study, 44 beats per minute were considered as basal values for heart rate, with donkeys only being able to start a new transect when heart rate was 44 or lower. In terms of main results and in general terms, there was a significant increase in the force exerted when moving the greater loads, as you can see in the top right parts of this combined imagery different graphics. There was an increase of 24% force measured between 0.03 cubic meters and 0.05 cubic meters, with an increase of 16% force between 0.05 and 0.07, and a 34% decrease in force required was observed between 0.07 and 0.1 cubic meters. And in this specific case, we are not considering the logging method, just the difference between the logs. If you look now to the top left and specifically talking about the different methods, the rect pull, despite being the most common technique used in logging operation and the most efficient one in terms of time needed to move the logs from point A to point B, especially in short distances, it is also the method that required the greatest force. The rect pull required 20% greater force compared to the sled and 60% greater force than the vehicle. The sled required an additional 58% of force compared to the vehicle. In terms of BPM, heart rate, greater heart rate was observed when using either the sled or the direct pull methods to transport logs compared to using the vehicle, as you can see on the bottom left graphic. Hence, independent of the method used to transport the load, as the load increased, the heart rate of the donkey significantly increased. Heart rate increased 5% between 0.03 cubic meters and 0.05, 10% between 0.05 and 0.07, and 12% between 0.07 and 0.1 cubic meters. There were significant interaction effects between force required to pull the different loads and methods used. The rect pull and sled presented very similar results when moving the lighter log, but the difference between these two methods gradually increased when moving heavier logs, as you can see when comparing the red and green lines. The force needed to move the logs with the vehicle was always lower and almost constant during the trials. Going back to the heart rate, with lighter logs, greatest beats per minute was actually observed using the vehicle, which was significantly greater than using either the sled or the direct pull method. Things start to change when moving 0.05 cubic meters, where there was no significant difference in BPM between any of the methods, as you can see where all these three lines intersect each other. But then when pulling 0.07 cubic meters, both the direct pull and sled transportation methods results in a greater BPM than observed when using the vehicle, and when transporting the heavier log, the direct pull method resulted in the greatest BPM, followed by the sled, and with the vehicle showing the lower BPM. So moving on to the discussion and somehow the conclusion of this study, it is true that the use of vehicles proved to be the technique where the donkeys needed less force to move the load, demonstrating that an even more noticeable difference as the weight increases due to the presence of wheels and complete lack of contact between logs and soil. However, we should not forget that the correct harness needed to move and eventually brake a vehicle is more complete in comparison to the one used for direct pulling and for sled, and should include, apart from the collar, traces and swingle tree, the cart saddle to carry the load, a breeching to brake the load, and the belly band. And in the real world, it is quite common to see working donkeys with incomplete and ill-fitted harness, and the more complex or complete the harness system is, the more likely it is that important parts for its correct functioning are missing. All this potentially increases the likelihood of inefficient transfer of power, leading to important skin injuries. And some other aspects to keep in mind regarding the vehicles is that donkey owners and users require, or will require if they decide to use this technique, not only more skills to load the logs, but also the ability to drive and maneuver the complete set into the forest, and this is important. But of course, the price of the equipment is another key aspect to consider. The cost of the complete set of vehicles is very high for millions of donkey owners, considering their social economical situation, and even manufactured locally by recycling material, the price will always be higher when compared with sleds and direct pull methods. So, sleds proved to be a good option to reduce the force needed to move the load, especially with heavy logs. This technique reduces the area of contact with the log, between the log and the ground, thus reducing the friction and resistance. And sleds can be pulled over rough terrain, this is important, work well in transversing slopes where a vehicle might tip over, and are much easier to maneuver inside the forest. Being low to the ground, they are very easy to load up and to unload, and more stable than the vehicles. From a harness point of view, the same harness used to move the logs using direct pull is used with a sled. And this is a real advantage, as the sled can be used as a quick complementary logging method when the load to be moved is too heavy for the donkey, without the need to change harness or hitch the donkey to a vehicle. As another important aspect, the dynamometer really proved to be an excellent method to assess the force exerted by donkeys during forestry work, using different techniques, and thus a good tool to monitor animal welfare. Such method, however, does not allow real-time results, and this is important, and therefore it is not impossible to adapt or correct the work being carried out at that moment. As such, it is essential that operators learn how to be aware of early signs of fatigue in donkeys, such as slowing down, reluctance to move, or increasing respiratory rate, as a way to avoid any further problem. In terms of heart rate, and considering the results obtained in this study, the use of this method as a proxy measure for force exerted whilst transporting different loads using different methods did not provide good results for all the tests performed. Although it is important to mention that the fact that the first logs were so light, representing only 8 and 13% of the body weight of the donkeys, may have affected the results obtained for heart rate, with the physical effort required to move these logs being higher when using sled and vehicle due to the weight of the implements. And this factor may explain the higher heart rate observed for these techniques. Actually, it was observed that with the weight of the logs increasing, followed by the increasing force requirements, the correlation and the explanatory power became greater. So these results indicate that with heavier logs or methods that display greater force requirements, heart rate may eventually be used as a proxy method for force, but of course, further studies are needed. And finally, in terms of the collars, in the present study, we didn't observe any significant differences in terms of force when using different collars. We believe that due to the weight of the logs used in terms of the percentage of the body weight of the donkeys was somewhat conservative, considering the real working conditions donkeys may face while logging. These were enough to highlight differences between logging techniques, but not between collars. Although, based on previous studies using pressure pads to assess contact area and pressure, authors concluded that such parameters vary between collars and effort, with design and expansion capacity of the collars playing a major role. Full collars showed better results when compared to pressed collars, so whenever possible, donkey should always work using full collars that present a correct design, adjustment capacity, and appropriate padding and manufacturing materials, while avoiding pressure in the trachea and points of the shoulder, and these aspects should always be kept in mind when working with donkeys. Thank you so much for your attention, and I'll be very happy to answer any of your questions. Thank you.
Thank you for that talk, João. Really interesting key points there, and we've had a couple of questions through for you. So first of all, thinking about the number of working equid NGOs around the globe, and already what we've heard today as well in terms of that understanding of sustainable harness practice, what are your thoughts around how we shift forward that sustainable harness practice?
Hello, very good question. Indeed, if we talk about working equids, if there is a common factor that actually it's part of the daily life of any working equid in any part of the world, are harness. And it's interesting to see sometimes they are not considered, because what we see in terms of lesions, as Tamlin just showed us, with those lesions in the mules, those lesions are not the cause. They are just the consequence of incorrect harness. So I think we are in a much better position than when we were in the past. I think the fact that, for example, an organization like the Donkey Sanctuary is actually promoting this type of studies where we can have this scientific data, reliable data, to show the importance of good harness. I think that's the correct direction. Of course, there are a lot of things that need to be done, but I think we are in the right direction when we are now assuming that the harness should be part of all the work with working equids, when we are, for example, using our platforms, our online learning platforms, preparing courses focused on the correct use of harness, and the welfare linked to that correct use of harness. So I think we are not there yet, but I think there is a more awareness of the importance of harness when talking about working equids.
Fantastic, thank you. And just a quick question from the question box as well. We've got a question about the brand of heart rate monitor that you used.
Okay, that was the equine Polar one, the commercial one, the Polar. We had some initial difficulties to adapt it, mainly because of the amount of hair that these donkeys have. So in theory, it should work with the sweat of the animal. So there's an electric impulse that needs to be measured. So we ended up using, in between the body of the animal and the tape, we used the ultrasound gel. So it allows us to, the one used for normal ultrasound in animals, allow us to keep the area always moist. So with water, it dries really, really fast. But with the ultrasound gel, we managed to have the perfect reading of the Polar. The nice thing about this system, it also includes the GPS. So we are actually able to then link the force of the dynamometer with the movement of the animal and the heart rate, because everything comes in the Polar web page where you have access to all the software.
Fantastic, thank you very much. Some really useful further information there as well for future practice. Brilliant, and we do have a few more questions for you, João, but we'll move those to the end of the Q&A session. And thank you very much. Great, and we will go now to our next speaker, Glen Cousquer, who's at the University of Edinburgh. Glen is a lecturer in One Health and Conservation Medicine. Glen's research and teaching focus on awareness-based systems change, addressing the relational pathologies rising from humanity's disconnects from body and the more than human world. And Glen's going to talk to us today about from domination to dialogue and the ethics of the between, transforming human working equine relationships in mountain tourism.
Good afternoon, ladies and gentlemen. My name is Glen Cousquer, and it's a real pleasure to be here with you today. I am very grateful to the Donkey Sanctuary, to the Austral Journal of Veterinary Science for this opportunity to share with you my work and passion for pack animal welfare, and specifically for the welfare of pack mules working in the High Atlas of Morocco. My first visit to Morocco dates back to 1995, and that visit exposed me to many of the problems that I then went on to study as part of a project that extended over about 10 years that encompassed my doctoral research, and that I'm looking to share with you today. This work has in many ways contributed to the professionalization of the industry, of the mountain tourism industry, and has in turn fed into the development of action research approaches to pack animal welfare, and indeed to animal welfare. And one of the things that I'm wanting to tease out here for you today is the importance of listening and of this transition from domination to dialogue that allows us to address what I describe as the ethics of the between. Many of you who have read the paper published in the special edition of the Austral Journal of Veterinary Science will probably be left wondering how on earth I am going to synthesize and condense this extensive piece of work into a short 15-minute presentation, particularly as I'm eating into that time as we speak. And I guess what I'm going to try and do here is share with you how developing a systems approach to a problem can allow us to address upstream causes of the presenting problem. And a systems approach, and this comes from Fritjof Capra's work, encourages us to shift our attention, to shift our focus, in the first instance from objects to processes and relationships, and this is really, really important, but also from hierarchies to networks, and from objective knowledge to contextual knowledge. The contextual knowledge aspect here is really key, because this is about ethnographic work that allows us to understand the systems within which an issue finds itself embedded, and that needs to be understood much more holistically if it is to be transformed. Shifting our focus requires us to first suspend and then redirect our attention. And one of the main ways that I developed in my fieldwork to facilitate this suspension and redirection of attention was through both still photography and video. And here in this image, we can see that something may be going on within the mouth of this mule, but that the mouth pain and injury that actually is there to be explored, the story of this mouth pain, the story of the various causes of the pain, remain invisible. Still photography allows literally the viewer to gain access to get into, in some ways, the mouth of the mule itself. And it then becomes possible to notice things that would otherwise not be noticed, such as the hint of blood here in the saliva of this mule. Careful examination of the mouth allows the underlying injuries caused by the bit to be identified, and for these then to be shared in a much slower and calmer way with the owner. The mule shown in the previous photo, it turned out, had an underlying lameness, and the handler, the young man who worked this mule, was unaware of that and was very inattentive in his use of the bit, causing this injury. That mule was retired, and the young man obtained this very nice grey mule, and it was very distressing to find a similar injury within this mule's mouth. And yet this also provides us with an opportunity to dig into some of these upstream causes and develop a richer understanding of the causality of these kinds of injuries. A very superficial reading would conclude that the traditional bit is the cause of those injuries. This is a very objective view of the cause and effect relationship, concluding that the traditional bit is responsible for these injuries, and therefore that what is needed is a different kind of bit, a more humane bit, a less traumatic bit. Our attention is very much on the bit and the interaction between the bit and the mouth. We may actually look as far as the hand and conclude that this is a traumatic injury arising from the bit being abused within the mouth of the mule. Stepping back, however, redirecting our attention after having suspended that initial reading, we are able to look in a more holistic way at the relationship between the mule and the handler. This new reading recognizes that the traditional bit is brutal and is easily abused. It recognizes that owners' hands are often hard, And it also recognizes that in many cases, the understanding and communication that takes place between man and mule is poor. However, my argument here is that this problem statement is incomplete, and we need to step back further and consider the detailed construction of the relationship between the mule and the man. Suspending and redirecting in this way, we can move from the objective structures that present themselves immediately to our attention to the underlying processes, often mechanical, that give rise to these first findings. And then we can start exploring and untangling, disentangling the thoughts and emotions that actually inform practices. And then right at the source, certainly at the level of an individual relationship, we can look at intentionality. We can actually look at the purpose that mule handlers, muleteers bring to their practice. This, however, requires a lot of relationship building, a lot of non-judgmental listening in order for the lived reality of the mule and of the mule owner to become available for discussion and exploration and inquiry. It also requires spaces, holding spaces, to be created in which we can actually explore alternative possibilities. We can bring in other ways of relating and establish a creative tension where dissonance can be experienced between one set of realities and another. In this particular image, we see the same young man actually enjoying a moment of play with his mule, and this has actually been made possible by a 6-month period of training and exploration, so that a lot of the muleteer's underlying uncertainty and apprehension and absencing was actually surfaced, and other ways of relating actually explored. And here we are exploring the ethics of the between. We're actually providing examples where dialogical encounter, so an encounter that is more mutual, more reciprocal, can start to influence the relational practices and therefore the relationship between these two individuals. And it's these moments, these I-thou moments, that Martin Buber describes as requiring us to turn to the other, to make ourselves open and available for transformation, that can be brought back into an I-it dynamic where we are working with the mule in a more transactional way. So the interplay between shifts into the I-thou and shifts back into the I-it are what transforms the ethics of the between. And we mustn't forget that the relationship between the mule and the muleteer is embedded in a much more complex socio-cultural and ecological setting. And those settings can enable, can encourage, can facilitate, can make possible the transformation of relationships. So what I've tried to illustrate here is an ecosystem view of the mule and of mule health, where we expand the problem statement to include the use of power between local trekking agencies and the mule owners themselves, where we also look at the use of power between the foreign trekking agencies who contract with the local trekking agencies. And we try and ensure that these relationships are characterized by a more reciprocal set of exchanges. And this is partly the shift from hierarchies to networks that I was referring to right at the start of this talk. But the last thing I do want to emphasize is this also extends to ourselves. When we reflexively actually think about how we relate, what we're modeling to our partners working in this area, we ourselves need to consider our own relationship to ourselves, but then the relationships that we construct with others. And we need to develop a fluency, a literacy that allows us to explore that within ourselves and without ourselves in order to then facilitate these explorations in the field with the communities that we're actually working with. In this short presentation then, I have tried to capture this shift from focusing on the injury, from focusing on the bit, from suspending and then refocusing on the hand, to suspending and refocusing on the handler, to suspending and focusing on the relationship building practices that exist, that arise between the handler and the mule. But then I've gone further again. I've suspended and I've taken this out in a wider sense to consider the relationships that local tracking agencies facilitate, nurture, and how the other stakeholders, the foreign tracking agencies, the tourists, ourselves as people working in this field also facilitate. And these are, in many ways, the norms that we are seeking to actually share. And it is this norm building, this capacity building project that I think can be realized when we look at the relationship building practices, the relationships that we ourselves nurture in every aspect of our lives. And that, I think, is the key message here when shifting from domination to dialogue, is that it fundamentally changes who we are. Thank you very much for listening.
Thank you, Glenn, for that really interesting presentation there. If I can just ask you one of the first questions that has come through around this, thinking about promoting systems thinking among stakeholders involved with working equid health and welfare, what would you suggest are the next steps around that promotion?
That's a really good question. And I think what you're describing feels like a shift in approach. And I think the first thing we need to recognize internally is that we may feel uncomfortable when we're moving from problem solving to facilitating other people problem solving. And the way I would describe this in terms of an inner shift that we first have to do is a shift from seeing ourselves as technicians and possibly as teachers. And I think traditionally, when you look at the kind of work that's been done within this, but within a lot of other fields, when we talk about education, we're talking about telling. We're very didactic, and I think that's because we've been enculturated into a didactic education system. Well, those of us who've gone through vet school and have become sponges of knowledge. So there's a real shift when we move from teaching to coaching. And if we're doing systems change, we actually need to go deeper and actually think about what is emerging through our own contributions. And this actually really shifts our focus from learning from the past into learning from the emerging future. And I think that the essence when sharing that with the communities we're working with is to actually drill down into values and what they want to see happening. And pretty much all of the communities don't want to be brutalizing. And if we can find that that way in and actually enable them to start to realize what they want to see being realized, you know, we're actually then working from the same sort of common ground, really. I'm not sure if that answered your question. It's I was trying to reflect that there's an inner shift that has to happen first before any outer shift can actually happen.
Thank you, Glenn. Yeah, really interesting there. And we have another question around systems thinking that's come through, asking how we can get vets to incorporate this into their work when they're often time poor.
I love the paradox there, yes. Hopefully, what may have come across in some of the presentation there was that, you know, I'm very deliberately trying to slow things down. And I fully accept that we are all in modern life under so much pressure. We, in terms of our resources, you know, time being one of those, we are acutely aware that they feel limited. And I just want to highlight that that is buying into scarcity thinking. And the shift away from scarcity thinking into abundance thinking actually can allow us to, you know, to address those different properties. But there's a lot of unlearning that has to happen for that. And, you know, I'm still unlearning a lot of that, but it's kind of what has fed into my teaching. So I bring a lot more grounding work into teaching, a lot more of that into workshops. And what I mean grounding, you know, where I'm moving through with that is into mindfulness work. So awareness-based systems change is about observing our thinking and recognizing that awareness and thinking are completely different things. And in order to see change in the world, we have to nurture awareness. So my argument would be, you know, we can find space within the day to actually develop contemplative practices. And those shifts change reality. They are literally reality changing because they develop greater awareness at the individual and collective level of what we're actually facing.
Thank you very much, Glenn. A lot for us to reflect on there as well. And some more questions coming through that we will save for our final discussion as well. Thank you ever so much for your talk there. And now we will, thank you. Now we're going to move on to our final speaker, Tamara Tadich, who is at the Universidad Austral de Chile. Tamara is a veterinarian with an MSc in equine science and a PhD in veterinary science. Tamara's an associate professor, and her research focuses on working equid welfare. Tamara is going to talk to us today about the use of thermography and pressure sensors to evaluate the effect of load on pack mules.
Good afternoon, everyone. I would like to start thanking the Donkey Sanctuary for organizing this webinar and allowing us to share our study that was published in the special issue. I'm going to present on behalf of my co-authors, Javier Lagos and Igor Gonzalez. So we did this study entitled Use of Thermography and Pressure Sensors to Evaluate the Effect of Load on Pack Mules. Just a reminder that working equids can be horses, donkeys, mules that either directly or indirectly facilitate the obtention of a resource that is important for the livelihood of the owners or caretakers. And in this case, we worked with mules, but in Latin America, we can find mules that are usually working as pack animals, or donkeys, which are mostly used for draft work and pack work, and also horses, which are also used for a diversity of activities. So mules are usually used as packed animals in mountain regions, and this is the case of the Andes here in Chile. And it's one of the main reasons why the army keeps and breeds mules so they can work under this harsh condition. Therefore, we consider that it was important to assess the effect of load work on the back health and its effect on welfare and the performance of these animals, because we know that most welfare issues related to pack animals are the presence of lesions or excessive workload that they have to carry. So to do this work, we worked with the Chilean Army, and they allowed us to use 12 adult working mules, which were all between 8 and 13 years of age, and with an average weight of 360 kilograms. We assessed 3 different loads, 80, 105, and 130 kilograms. And this load includes the weight of the harness, which is around 23 kilograms. We decided to use these loads because currently the Army does not allow to load mules with over 105 kilograms. So we decided to test 25 kilos below and above this load. We used a crossover design, so each of the 12 mules was assessed carrying each of these 3 loads in different times, and they all did a short circuit of 2 kilometers in a randomized order with a time between each of these assessments of around 2 weeks. So these 2 kilometers were hand guided by soldiers that knew the mules from before, and was conducted between November and December, which is our summer, at an army enclosure which is located in the Andes. And the temperature when we were assessing these mules fluctuated between 32 and 39 degrees Celsius. The humidity was quite low, 24%, and the mules were working between 850 and almost 880 meters above sea level. So you can have an idea of the environment. So the study design, first we assessed the health of the mules that participated. So we were sure that they were all sound at the beginning. We also checked for wounds. And then we took a thermographic image of their back before they performed the work. And we also took a blood sample so we could assess serum amyloid A. Then the soldiers, they were in charge of doing everything related to the harness and strapping the mules. And we placed the sensors, the pressure sensors that we were using between the padding and the harnessing of the mules. So they were not in direct contact with the skin or the back of the mules. Then they walked for 2 kilometers. And when they returned, we took another thermographic image, another blood sample, and this was repeated over time until day 5 after work. So these pictures are, so you can have an image of the mules that the Army has. We classified them in a previous work, so we were using 4 small mules that had a height to the withers of 1 meter and 32 centimeters in average, medium-sized mules with 1 meter and 40 centimeters to the withers, and the larger ones which had an average of 1 meter and 60 centimeters to the withers. So we also compared the differences between the size according to the size of the mules, because they could respond differently. And here, just to show you the percentage of their body weight that they were carrying, and according to the size of the mule, and you can see that none of the mules carried over 40% of their body weight. So some of our results. These are the results of the pressure sensors. For this, because we had 4 sensors on each mule, we divided the back of the mule in 4 quadrants or areas. So we have 2 front and 2 posterior areas. And the results of the pressure analysis between the 4 quadrants did not report any significant differences between them. And this suggests that the weight distribution was symmetrical, which could be related to a correct strapping of the harness on each mule by the soldiers, which are trained to do this, and the fact that the loads located on each side had the same weight, and they were well tied and balanced, allowing a good weight distribution. That is why we don't see any differences between the pressure. And we didn't find any significant differences between the treatments in either the average, maximum, and minimum pressure. Therefore, it is not possible to conclude that the weight of the load affects the pressure force or the magnitude and the balance of the load for this study. It also has to be considered that mules carried between 16% and 44% of their live body weight, but unlike a rider, the load used here does not move by its own, while when you have a rider, he's in constant movement, and that creates different vertical ground reaction forces that we don't see with this type of load. Maybe we could see this movement if the strapping is not done correctly in the harness, or if the harnessing system used is not appropriate, and that allows the movement of the load during work. And that's why it's so important to train people on how to put the load on working animals. Here you can see the harnessing system. So below this, there is the padding and then the back of the mule, but just so you can have an image. This is an old harnessing system, which is from Germany, and it's the one that the army here uses. So these are the thermographic images, just some examples. We also divided the back of the mule in 4 quadrants or 4 areas. And we took the average temperature of each of these areas in each time. And we also assessed the average temperature of the middle line and the area of the wither. So here you can see how the temperature increased over time. Here we have the sampling time, and we did not find any significant differences between quadrants or between treatments. But within treatments, the 105 and the 130 kilogram loads were the ones that caused a significant increase in temperature when compared to the baseline of each treatment. It is also important that the midline and the area of the wither are areas that showed significant increases in temperature, and these areas have very few soft tissues and should not have direct contact with the shoulder strap. However, this increase in temperature appeared, and it could be the result of the padding that is being used, which should help distribute the load over a larger surface, but it may be causing friction or greater pressure if it's not correctly positioned. Or maybe it doesn't have enough thickness for the load that the mules are carrying. And in the case of the withers, maybe the increase can be associated with an incorrect adjustment of the harnessing system too far ahead, which could generate some friction with the withers area. It is also important to say that we did not find an association between these changes in temperature from the thermographic images and the pressure obtained by the sensors. Finally, we also assessed serum amyloid A, which is a positive major acute phase protein in equids, which is usually has very low concentrations if animals are sound, but even non-infectious factors such as this case, working load, could produce a very fast increase in the concentrations of this protein. And that is why we decided to assess it. And we used a semi-quantitative test, an ELISA. And what we found was a significant increase in this acute phase protein, in particular for the 130 kilograms treatment after 72 hours of work. Something that should be considered is that maybe we should have taken a sample earlier in time, and maybe would have seen an even major increase for the other treatments. And that is something that we should take into account in future studies. And just to conclude, we have to remember that overloading is one of the main welfare issues reported in working equids. And it can be very difficult to calculate load limits because it depends not only on animal-related factors, such as the species, the age, the body condition of the animal, how fit it is to work, but also external factors such as environmental temperature, humidity, the type of terrain where we're asking the equid to work, or the quality of the harnessing system. And in this study, although the work was very low, it cannot be compared to the workload that most working equids do worldwide. We did see that heavier loads resulted in a significant increase in the superficial temperature in all areas of the back that were assessed, and in particular for the heaviest loads. And this was associated to an increase in this acute phase protein. So even for this really light, short work, we can see these differences. Probably in other animals that have poor quality harnessing systems and are working under much more harsh conditions, these differences would be higher and should be considered. I would like to thank all the students that participated in the study, and in particular to Javiera Lagos and Igor Gonzalez that did their postgraduate studies with these animals. So thank you very much for your attention, and I hope that you enjoyed this study.
Thank you very much for that, Tamara. Fascinating study there. We've got a number of questions coming in around the commercial sensors that were used. And I know that there can be problems sometimes when these are used with animals in particular. So there's a question around, in terms of the sensors, whether you did have any problems and how you addressed those, if so.
Hi everyone. Yes, we had a lot of problems with the sensors. We couldn't use commercial ones, which are mainly designed for a saddle for a rider. So we worked with a group of engineers, and they developed these sensors, especially for us, considering the different loads that we were going to use.
Excellent, thank you. And then we have a question just come through into the chat box asking if the army soldiers or personnel related your work to their own human working conditions and perhaps including that workload element there.
Well, it was really nice to have this first project with the soldiers because we realized that they don't really have a bond with the mules. They find them very aggressive. So, and you can see there is a continuous tension when they are working together. And that has raised a new project where we are going to work in particular with the behavior and training of the mules and the soldiers. But we have asked soldiers their perception about mules. We have another article published on that. And although they consider them very aggressive, they find that the mules are the best equid with which they can work. They find them very intelligent and they prefer to work with them. They feel more confident working with a mule in the mountain than with a horse, for example. So we think we have a lot of work to do in order to create like a better relationship between the soldiers and the mules. But it also happens that people rotate a lot. So maybe that's one of the situations that we need to work with the army, because they don't get to form a bond with one particular mule. They're just assigned to an animal, and it can be a different animal each day. And we know that mules are more of a routine animal, so they need to have a more like continuous work and be very consistent on how you handle them. And they do realize that mules relieve a lot of their work because otherwise they would have to carry those loads. So there is a notion about that.
Thank you. Really interesting thoughts there as well to take forward. And thank you everyone today for speaking, and thank you, Tamara. We have some more questions for you as well going into the next Q&A. But a big thank you to our panel too as well. Some really novel approaches there to supporting improvements for welfare in working equids, and with some real clear practical applicability there as well that we can discuss further. I think there's some key questions around that in our Q&A. So we will now move to our final Q&A discussion session. So if I can ask, if I can just invite everybody who spoke today, if you could turn on your cameras for us, and we've got some questions that we didn't quite get to earlier. So I will pass to Rebekah to ask the panel 1 questions, and then we'll move on to our panel 2 again.
Thanks, Fiona. So I've just been running back through the chat here, and I'll pick out a couple of questions that don't seem to have been answered yet. But please do feel free to stick your hand up or shout out if there's anything else that I've missed. So my first question's for Amanda. Amanda, this actually wasn't in the chat, but it's something I've picked up on. So somebody was asking you in the chat about the use of routine dewormers in your clinic, and I noticed that you'd written that it's quite routine that anyone attending the free veterinary aid clinics, they do get dewormed. I'm doing quite a lot of work at the moment looking at responsible anthelmintic use, and I've actually just come back from a project in the Gambia where it's one of the things that we were talking about, and I just wondered what your thoughts were on the best way to sort of make sure that we are using anthelmintics responsibly. And I don't mean it to be a sort of targeted question, but it's just I'm sort of questioning myself. I'm wondering what others here think. Like, is it the right thing to do in these clinics to be just routinely deworming everything that turns up?
Yeah, very interesting point there. I know that since we had done those fecal egg counts, we have sort of been steering away from routinely worming everything that comes through the clinics on the Gili Islands, and we sort of reserve worming for the animals that we do see that actually have a clinical parasite burden, which I think it's important that we sort of maintain the same practices in terms of anthelmintic stewardship and preventing resistance. I think it's ongoing. We're pretty keen to continue with fecal leg counts and tailoring our treatment in response to what the fecal leg counts are showing us.
Thanks, Amanda. Before I sort of come back on that, I can see Glen's got his hand up.
Yeah, it was just to say that from a One Health approach, there will be a shift happening, I think, over the next 5 to 10 years. So one of your colleagues, Rebekah, on the One Health MSc program is looking at conservation grazing, and it's amazing how many conservation areas are using livestock, including working equines, to graze an area for conservation reasons. And these are conservation areas often are being protected because of their invertebrate populations, and there isn't thought going into ensuring that none of those anthelmintics make it onto those reserves. So I think we need much more joined up thinking around this whole issue. One of the striking things in Morocco in the national parks was you just didn't see any dung beetles. Go to other valleys where they don't worm, and you've still got healthy dung beetle populations. So there's a lot of work there that I think we need to be developing to sort of evolve our systems approach.
Yeah, thanks,
Sorry,
Glen. No, not at all. It's fascinating sort of for me, and I imagine for quite a lot of people who are participating here. And it's a theme that has come through all of the talks that we've heard this afternoon, is that we know what is currently being done well, we know what is currently being done badly, but it's how we're going to shift forwards to what needs to be done in future to protect not just the working equids, but also the whole environment. So thanks, Amanda, for sort of inadvertently facilitating that question. And then I've actually got one for Tamlin, which I know was in Fiona's side, but I just noticed it coming through the chat, and it is sort of a bit more vet related. So Tamlin, the question that came through was from Isabella, and regarding your talk, she was asking whether the vet techs were part of government extension services or whether they're privately employed or self-employed. And the other question, which I'd be intrigued to hear about, because it's a particular interest of mine, is the suspected glanders case you mentioned, was that tested, and what is the level of understanding of the vet techs regarding glanders?
Okay, so I'll start backwards. So the level of understanding about glanders with the vet techs, I have no idea. I'll be completely honest. The training they had in equids specifically lasted 2 weeks. And I don't know what that contains. That wasn't something that we completely explored, but it'd be something of interest, I think. The reason we knew about the glanders case was, well, suspected glanders case, was the vet that was actually present with us from Animal Nepal. So as I was assessing, I backed off from one mule and I said, "This doesn't look very good." And she came up and said, "Oh." So we asked the owner to isolate it as best they could, but we were right up in the mountains. So as for follow-up, it was really difficult to do that, because we weren't planning on coming back down for some time. So it was on the route up. So all we could rely on was the owner isolating as best they could. In the meantime, this sort of highlights the difficulty working in those areas. And the vet techs were part of the government extension services. As far as we're aware, they weren't self-employed. Does that answer everything?
I'm not sure if Isabella is still here. Yes, she does appear to still be on the call, but Isabella, do just drop into the chat if there's anything further. Before I pass back over to Fiona, did anybody have any other questions for Amanda, Carolina, or Rabiaa? I believe, Glen, you had your hand up during Rabiaa's talk. Not sure whether that's been answered now.
I guess it was more to in some ways I can relate it to what I was discussing. So a lot of the anthropological work I was doing around tethering in Morocco was actually looking at trying to understand the motivations for tethering. And I think there are different situations. So the market situation is very, very different, because literally it's a slave market. You know, you have donkeys that are tethered, usually with bale twine to a rope, or the other alternative in a market situation would be that it's just a parking. And you can imagine people just reversing their cars in and not thinking about it. So the change required in terms of sort of restructuring the network of actors there, the living actors and the non-living actors, would make for a fascinating project. And I guess that's the challenge involved in going out of the community, out of the clinic and into the communities, and sort of doing that kind of work. And I'd love to know whether anybody's managed to make any inroads into changing those tethering practices. But yeah, I guess it was a sort of an open inquiry on how do we move to prevention rather than treatment.
Thanks, Glen. You froze. I don't know whether it was my connection or Glen's, but it froze at the end there. But just I'm going to hand that over to Rabiaa to say, have you got any comments on what Glen was musing there?
Thank you, Glen, for your thoughts. And I think what you presented in your presentation would make a good understanding to the improving the approaches in terms of changing the culture behind the tethering or hobbling between owners, and try to dissipate this information between all of them. And it will be very hard, because even if you try to reach like a population, you will be missing another population as well. So it should be like a cooperative or collaboration of all like vets in Morocco, or maybe having other vets as well from like internationally, and help like get this information spread throughout the community. So yeah, it would be great to do that. Thank you very much.
Thanks, Rabiaa. I think there's going to be quite a lot of ongoing discussion after this webinar. I've just got one final one for Carolina, and then definitely over to you, Fiona. Carolina, one thing I'd missed actually this question coming through earlier, is what sort of level of infectious diseases you're seeing in the clinic that you were talking about in Chile? What's the sort of presence of infectious disease, and what are they part of the main health concerns, or is infectious disease sort of low down on the scale of what you're seeing?
Yeah, believe it or not, one of our more common infectious diseases here is tetanus. And it's a little bit because there's no culture about vaccinating. Luckily, or not, due to coronavirus, everybody knows about vaccines and talks about vaccines and how important they are. So now this conversation is a little easier with the owners. But we have the other hazard in this constellation, is that our tetanus vaccine that we have available in Chile is only the one that is together with influenza, Frequenza T, and that is a very pricey one. So costs like the same price of visiting a veterinarian or buying 2 sacks of food. So for the horses, so people tend to not to vaccinate. And plus, since it's only one horse every so many that die from it, but when they die, it's horrible, that it's hard to convince them to that. And the other one that it's complicated to diagnose, but we have a lot, is strangles. So those are the most common ones. We have herpes viruses, luckily not yet the herpes 1. And the other cultural thing is not when you have an abortion, people just say, well, oh, it just aborted, and nobody thinks about infectious diseases causing it. So we have way more infectious diseases in the horses that we think because we don't test. And since I just came back to Chile in 2019 and I was trained in Canada and Europe, so I'm very into looking into, we have to test everything, and we find a lot. But when I was trained in Chile in the 2000s, the theory is we have the Andes and we have the desert and we have the ocean. We don't have infectious diseases, but we have way less than Argentina, Peru, Bolivia, Brazil. But we have a lot of infectious diseases that are not being tested. We are luckily still free of infectious anemia, paraplasmosis, and some other ones in theory. But yeah, those are the main issues here.
Thanks, Carolina. That's another take-home message for this afternoon is just how much reviewing and reflecting on what is currently happening and what still needs to be done. Anyway, I shall hand over to Fiona to field the rest of the questions.
Thanks, Rebekah. So I will move to a question for João. We've got a question here around, in your presentation, you shared with us about how the harness can be used in communities and the impact of that. And there was just some thinking around how we can share that science with owners and ensure that that message is passed on to where it will make that difference to welfare.
Great question, Fiona. That's something we always keep in mind when we run these studies. We are completely aware that the same public that will read a paper is, of course, not the same public we want to reach. That's the same reason why we actually organize this webinar, because we know that just by doing this, we can reach other audience, right? So I can share with you the experience of the Donkey Sanctuary. We are completely aware that the data we produce are relevant, but so we thought about creative ways to share this knowledge. And one of them is probably what is one of the biggest projects we have now in hands, that is the Donkey Academy. This is an online learning platform. And as part of those courses that we prepare for this learning platform, we basically converted all this scientific data and information into do-it-yourself courses. For example, how to make your own collar, or in training courses, how to properly use the harness of your animal, how to harness, unharness, how to properly look after your animal. And as part of that, we include the train the trainers process. So as part of the new strategy of the Donkey Sanctuary, we will work based on partnerships, and we want to make sure that we spread the knowledge and the word through these partnerships, giving them the necessary tools for them to be able to learn and to spread all this knowledge in terms of harness. So it's a complex process, but we are trying, and this is just an example of how things should be done, trying to convert scientific language into practical language, so people, basically donkey owners and users, can have access to this information as well.
Thank you, Joe, and lots of resources there for people to access. That's fantastic. Thank you. And Glen, if I come to you next with a question that came through, looking at how to include all of the fascinating work that you were speaking to us about with the communities when they have such complex needs in terms of surviving with their animals on a daily basis, how we can integrate those factors.
Can I just clarify what the question there is about then? So there's an aspect there about surviving and the imperatives of and priorities of those communities, but in terms of integrating, did you have something particular in mind? I don't know if the questioner wants to flesh out their question, maybe give it some context, because sometimes it's very easy to talk about these things in the abstract, but it needs a little bit of context to help us understand how we prioritize. So already by phrasing it like that, I'm talking about our practices. So when we talk about how we prioritize, there are prioritizing practices. So maybe I'm just going to pick up on some of the stuff that João was talking about there. From systems change, one of the things we we can learn from indigenous communities is that our nouns, the nouns that we use in the sort of Western world, are part of the problem, and it's why we're so lacking in nimbleness. And the shift in that indigenous communities can help us with is to bring verbs in more and actually look at how much more dynamic things are when we put more verbs in our sentences, and we actually look at the practices that make things, that animate the world and that connect us, because that brings in the connecting again. So yeah, maybe if somebody, if there's a specific context, I could maybe thread it into that, but I'm trying to give you a flavor of how I would actually approach it. And I guess the other thing is, the other verb I bring in there is partnering. So just exploring how we partner can be really key. There will always be challenges because so many systems that we're trying to contribute to do have a hierarchical element to them. So I think flattening would be another verb that I actually want. So moving into networks where there is more flow happening within the system, and rendering visible. The way we render visible means that we can create spaces in which people can try something new, and then once the prototyping has moved through from maybe a 0.7 to a 0.8, 0.9, it can then be shared. It's ready to be shared. So it's all about these practices and paying more attention to them.
Thank you, Glen. It's really, really helpful ways to think about that as well in terms of our approach to the language around that. And I have a final question for Tamara. And this question was very much around the awareness of the soldiers that you worked with in terms of their understanding of animal welfare, and whether you felt that those discussions engaged them.
Well, at the beginning, when we asked the army if we could do the study and we used the word welfare, they were a little afraid. I think because, all the social media, and there are a lot of groups that don't want animals to be working, so they were kind of a little alert. And we changed, in the project, we changed the word welfare with exercise physiology. And we didn't have any problems. And then through the work, we started using the word welfare, and now they are very enthusiastic about doing more welfare things, because they realize that it's not that we want them to stop using the mules or the other equids that they have. We just want to create or develop guidelines or make the work of the soldiers easier if they're going to be handling animals. So I think now they're being very proactive, and they want to include the word more. We have had some workshops with them about welfare. So it has, I think it has opened like a new view of what we mean about welfare, and that we're not like activists that just want to not let them use animals or something like that. So I think it has been changing in a very positive way, and that's really good.
Brilliant, thank you, Tamara. Really, really positive message there as well regarding that engagement. Fantastic. We do need to leave our Q&A there, but thank you so much to all our speakers for engaging with that. And as we said earlier on, if anyone does have any further questions, please do feel free to contact our speakers or ourselves to share those questions. I'm now going to pass for final remarks to Eduardo Santurtun, who's our Regional Director of the Latin America and the Caribbean Office of the Donkey Sanctuary. So Eduardo, over to you.
Thank you, Fiona, and thank you for all the speakers and the committee that organized this seminar. Of course, to the Austral Journal of Veterinary Science. It's very interesting that more journals like they are keen to include the working equids topics, like the Australian journals. So thank you for this session. Just final remarks to close this today's session. I will say that it has been a very interesting morning for me, afternoon for you guys. In terms of what has been presented, I would like to summarize that the part of the vet presentations, they address what not just the Donkey Center, but all the organizations that we are working to improve the welfare of working equids we are facing around the world. One of them is, of course, to include some of, which is very interesting, and this is what we will be doing in the Donkey Center, working based on evidence. So some of the presentations, they address those things, like the part of the education on owners, on the different stakeholders, that they have an impact on donkeys and mules. And it was very interesting to see from the first three presentations that they have these long-term studies, like the one in Morocco, the AGs study looking for the whole materials and the importance of to improve maintenance and the management, and of course education of owners. And like all of us that we are working in the rural communities, for example, the challenges of diagnosis as vets, that you sometimes you don't have the proper equipment, or you have access, or the people do not have access to those facilities. But also like the study in Indonesia, working with pulling cars. We know that the working equids also work in tourism, for example, and looking for things like heat stress. But again, looking for reviewing the sustainable options, looking to empower local vets, but also local service providers, as well as part of the solutions. And of course, the work done in Chile about the first report on clinical presentation, which is a very important one, because normally the vet is changing, but normally the vet schools, if they include something about working equids, they do not have those records, or they don't measure things, or they don't do this type of assessment. But it is increasing the number of universities that include, like the Austral Veterinary of Chile. So it is very interesting to also to emphasize the educational and preventive programs that are key for this. So again, looking for this One Health approach, or a sustainable approach as well. And then later we will move to other type of studies, like the one asking in Nepal, owners and mules, like many parts of the world, in particular Latin America. We have the American Cordillera, and mules are key animals for people that rely on them for the livelihoods. So in understanding more about the mules, I'm just moving also to the Glen's presentation about the ecosystem of the mules, understanding better, not just focusing on, for example, on the wound, but also looking for the other or the relationship between the man and the mule, but also include local and foreign norms. So that was a very interesting presentation. And the presentation from Tamlin emphasized on the veterinary service provision challenges, which is also one of the things that we are also reviewing in terms of how could we improve those animal health systems, or create those if needed. I would also like to emphasize the importance of research and investigation. The presentation from João in terms of the doing research about, in this case, it was about logging operations, but the importance, because if we want to work based on evidence and move this from this research to allow down that information that could have an impact on the donkeys and mules, that's one of the challenges that we are facing. And finally, with Tamara Tadich presentation in terms of looking for the question that all the time we were asked. I have even some presentation with Tamara. They ask her this question: how many weight I can put on my donkey, on my mule, on my horse? That's a common question. So that's why it's very important to have this type of studies to provide more, to have more information, so we can later provide this to the owners or different stakeholders. So a great seminar, a great webinar. It was a very interesting one. On behalf of the Donkey Sanctuary and the Latin American Caribbean office, I would like to thank all the speakers, all the moderators, the organizing committee, and the people that attend this webinar. So we are very happy, and hopefully we'll have these sessions in the future.
Thank you, Eduardo. Great to think about all of the things that we've heard today, as you say. We do have one final request as a group, and we did want to ask if anyone who would like to turn their cameras on so that we can have a photograph of this fantastic webinar and as many faces as we can who joined us today. So if you would like to turn your cameras on, please do, and we will take a photograph of the day. Fantastic, loads of cameras coming on here. Brilliant, thank you everyone. Give everyone a second. Just give us a moment to take that photograph. Fantastic.
Now. Yep.
We should have that. Brilliant. Thank you ever so much, everyone. And thank you again for joining us.